Hello everyone. Today we will talk about a very important topic for everyone, chest discomfort. Let's begin. Chest discomfort and the body signals chest discomfort, commonly known as chest pain or a feeling of unease in the chest, is an experience that almost all of us have felt at some point. It can be a brief, fleeting sharp pain, a constant pressure, or a burning sensation that won't go away. The first reaction to this symptom is inevitably worry. And with good reason. The chest is the home of vital organs like the heart and lungs, so any discomfort in this area is automatically associated with something serious, such as a heart attack. This anxiety is natural, and in many cases it acts as a warning that prompts us to seek medical help. The term chest discomfort is intentionally broad, as it covers a very diverse range of sensations. It is not limited to sharp pain, but also includes a feeling of tightness, heaviness, burning, pressure, or even a sense of emptiness. This variety of manifestations is one of the reasons why a diagnosis can be complex. The same symptom, like a stabbing pain, can be caused by a simple muscle strain or a serious lung condition. Therefore, it is crucial not to self-diagnose and instead, pay attention to the specific characteristics of the discomfort. To better understand chest discomfort, it's helpful to demystify its nature. Not all chest pain is a heart attack. In fact, most cases of chest discomfort that present in emergency rooms are not of cardiac origin. This does not minimize the seriousness of the symptom, but rather invites us to consider the multitude of potential causes. From digestive problems to musculoskeletal conditions or even psychological stress, the list of possible origins is long and varied. The heart, that tireless muscle that pumps life throughout our body, is the primary concern when the chest hurts. Pain of cardiac origin occurs when the heart muscle doesn't receive enough oxygen, usually due to a blockage in the coronary arteries. This type of pain is often described as an oppressive or heavy feeling, as if an elephant is sitting on the chest. Unlike other causes of pain, cardiac pain often radiates to other parts of the body, such as the left arm, neck, jaw, or back, which makes it easier for healthcare professionals to identify. Angina pectoris is a type of chest discomfort caused by myocardial ischemia, which means insufficient blood flow to the heart. This pain is typically triggered by physical exertion or emotional stress, and goes away with rest or the administration of nitroglycerin. It is a warning sign that the coronary arteries are narrowed and that the heart is working harder than it can. Although it is not a heart attack itself, angina is a symptom of an underlying disease that should be treated. A heart attack, or myocardial infarction, is the most serious manifestation of chest discomfort. It occurs when a coronary artery is completely blocked, depriving a part of the heart muscle of oxygen and causing its death. The pain is more intense, prolonged, and is not relieved by rest. It is often accompanied by other alarming symptoms, such as cold sweats, nausea, shortness of breath, and dizziness. Recognizing these symptoms in time is crucial for receiving immediate medical attention, as time is a determining factor in survival and recovery. But chest discomfort is not exclusive to heart problems. Gastrointestinal causes are surprisingly common and are often confused with heart problems. Gastroesophageal reflux disease, GERD, is an excellent example. It occurs when stomach acid flows back into the esophagus, irritating its lining and causing a burning sensation in the chest, known as heartburn. This pain can be so intense that it is easily mistaken for a heart attack, leading many people to seek emergency care.
Differentiating GERD pain from cardiac pain can be a challenge even for doctors. However, some clues can help. Heartburn pain often gets worse after eating or lying down and can be relieved by antacids. In contrast, cardiac pain is not related to food intake and does not respond to antacids. Even so, the similarity of the symptoms underscores the importance of a medical evaluation for an accurate diagnosis. Another less known but equally important gastrointestinal cause is an esophageal spasm. The esophagus, the tube that carries food from the mouth to the stomach, can experience abnormal and painful contractions. These contractions can feel like a sudden, oppressive pain in the chest that can last from a few seconds to several minutes. The pain can easily be confused with a heart attack, and the diagnosis often requires specialized tests to rule out more serious causes. The musculoskeletal system can also be a source of chest discomfort. One of the most common causes is costochondritis, which is the inflammation of the cartilage that connects the ribs to the breastbone. The pain from costochondritis is typically sharp and localized, and it can be reproduced by pressing on the affected area. Unlike cardiac pain, which is deep and diffuse, costochondritis pain is superficial and can be relieved with anti-inflammatory medications and rest. Muscle injuries in the chest wall, caused by overexertion, chronic coughing, or heavy lifting, can also lead to chest pain. This pain is similar to a muscle strain elsewhere in the body. It's sharp, localized, and gets worse with movement or deep breathing. Although it can be alarming, it doesn't represent a threat to life and usually improves with time and proper care. Lung problems can also manifest as chest discomfort. For example, pleurisy is the inflammation of the membranes that line the lungs and the chest wall. The main symptom is a sharp, stabbing pain that gets drastically worse when taking a deep breath or coughing. This type of pain is a sign that something is wrong with the lungs and requires medical attention to determine the cause, which can be an infection, an injury, or an underlying disease. Pneumonia. A lung infection is another common cause of chest discomfort. In addition to chest pain, pneumonia is often accompanied by other symptoms such as high fever, a productive cough with phlegm, chills, and shortness of breath. The chest pain is due to the inflammation and fluid accumulation in the lungs, which makes every breath painful and difficult. Stress and anxiety are factors often overlooked in the diagnosis of chest discomfort. A panic attack, for example, can perfectly mimic a heart attack. The heart races, breathing becomes shallow and fast, hyperventilation, and the chest muscles tighten, causing an oppressive pain. Often, the intense fear that something serious is happening only makes the situation worse, creating a vicious cycle of anxiety and pain. It's fundamental to remember that anxiety can have real physical effects on the body, and chest discomfort is one of them. Even if the cause is not a heart problem, the experience is just as real and terrifying as if it were. Therefore, it is important to address both the physical symptoms and the psychological causes. A healthcare professional can help differentiate between a physical and a psychological problem and provide the appropriate treatment for both. Beyond the heart, exploring other causes and the importance of medical evaluation. While heart and gastrointestinal issues often get most of the attention, there are other causes of chest discomfort that are just as important. For example, blood vessel disorders can be a source of pain. One of the most serious is an aortic dissection, a medical emergency where the inner layer of the aorta, the body's main artery, tears. This causes a sudden, intense tearing pain in the chest or back, often described as the worst pain you've ever felt. Early detection is crucial for survival. Another vascular condition that can cause chest discomfort is an aortic aneurysm, which is a bulge in the wall of the aorta. While many aneurysms don't cause symptoms until they become large or rupture, one in the chest can cause pain, hoarseness, and difficulty swallowing. The pain may be a sign that the aneurysm is growing and needs to be evaluated by a doctor as soon as possible to prevent a rupture, which can be fatal. Disorders of the gallbladder and pancreas can also manifest as chest pain. For example, a gallbladder attack caused by gallstones blocking the ducts can lead to intense pain in the upper abdomen that radiates to the chest and back. This pain is often confused with a heart problem, but it usually occurs after eating a fatty meal and may be accompanied by nausea and vomiting. The pain from pancreatitis, or inflammation of the pancreas, can also radiate to the chest. This pain is often severe, constant, and may improve when leaning forward. Although pancreatitis is an abdominal condition, its location and the severity of the pain can lead to confusion with a heart attack. A history of alcohol consumption or gallstones can give a doctor clues for a correct diagnosis. Spinal problems in the thoracic region can be another source of pain. The nerves that exit the spinal cord in this area extend into the chest, so a herniated disc or a spinal injury can cause pain that feels like it's coming from the heart or lungs. This pain typically worsens with movement and may be relieved with rest or physical therapy. Nerve compression in the neck or back can also radiate pain to the chest. This condition, known as radiculopathy, is the result of pressure on a nerve. The pain can be sharp, stabbing, or burning, and is often accompanied by numbness or tingling in the arm or hand. A physical exam and an MRI can help determine if a compressed nerve is the cause of the pain. Herpes zoster, also known as shingles, is a viral infection that can cause chest pain. The varicella zoster virus, which causes chickenpox, remains dormant in the body's nerves. When it reactivates, it causes a painful, blistering rash that can appear on the back or chest. The pain may start days before the rash appears and is described as a burning or intense stabbing sensation. A chest injury, such as a broken or bruised rib, is an obvious cause of pain, but it's not always easy to diagnose if the blow was minor. The pain from a ribcage injury gets worse with deep breathing, coughing, or torso movement. While not life-threatening, it's important to rule out internal organ damage, especially if the injury was the result of a serious accident. Autoimmune diseases like rheumatoid arthritis and lupus can cause inflammation in the tissues surrounding the heart and lungs, leading to chest discomfort. These diseases often have additional symptoms such as joint pain, fatigue, and fever, which can help doctors identify the underlying cause. Treating the underlying autoimmune disease is key to relieving the chest pain. Anxiety and panic attacks, as mentioned earlier, are a very real and common cause of chest pain. In a state of panic, the body releases a rush of stress hormones that can make the heart beat fast and the chest muscles tense up. This pain can be terrifying, but it's a manifestation of a psychological issue that requires treatment. Controlled breathing and therapy can be very effective. So, what should a person who is experiencing chest discomfort do? The first and most important thing is not to panic. Most cases are not life-threatening emergencies, but the fact that serious causes cannot be ruled out without a medical evaluation makes it imperative to seek help. Calling an ambulance or going to the emergency room is the safest option if the pain is severe, sudden, or accompanied by other alarming symptoms. In the emergency room, the evaluation of chest discomfort is a systematic process. The first step is a rapid assessment to rule out a heart attack. This includes an EEG electrocardiogram, ECG, which records the heart's electrical activity, and blood tests to measure troponin levels, a protein released when the heart muscle is damaged. If these results are normal, doctors can then move on to investigate other causes. The patient's medical history is a key piece of the puzzle. The doctor will ask about the nature of the pain, oppressive, sharp, burning, its location, its duration, the factors that trigger or relieve it, and any associated symptoms. Pain that gets worse with coughing or deep breathing points to a lung problem, while pain that improves when sitting upright suggests a heart issue. Amosis physical exam also provides valuable clues. The doctor may press on the ribs and breastbone to see if the pain is reproduced, which would suggest costochondritis. They will listen to the heart and lung sounds with a stethoscope and check for swelling in the legs, which could indicate a heart problem. A thorough examination is the basis for a correct diagnosis. Finally, if heart and lung causes have been ruled out, doctors may order additional tests to investigate other possibilities. Additional tests. This could include a chest X-ray to view the lungs, an endoscopy to examine the esophagus, or imaging tests like an MRI to view the spine. The goal is to find the underlying cause to provide the most effective treatment. Prevention, management, and the importance of education. Once the cause of chest discomfort has been diagnosed, the next step is treatment and long-term management. The therapeutic approach will depend entirely on the underlying cause. For a heart condition, treatment may include medications to lower cholesterol and blood pressure, lifestyle changes like a healthier diet and exercise, or medical procedures such as angioplasty or bypass surgery to restore blood flow to the heart. If the cause is gastroesophageal reflux, treatment may involve medications that reduce stomach acid production, as well as dietary changes like avoiding spicy and fatty foods and not lying down immediately after eating. The management of gastrointestinal causes often focuses on changing habits to prevent future episodes of pain. For musculoskeletal causes like costochondritis, treatment is often symptomatic. Over-the-counter pain relievers or anti-inflammatory drugs can be used to ease the pain, and rest is recommended along with avoiding movements that worsen the discomfort. In some cases, physical therapy can be helpful for strengthening chest muscles and improving posture. When anxiety or panic attacks are the cause of chest discomfort, treatment is geared toward mental health. This can include cognitive behavioral therapy, which helps people identify and change negative thought patterns, as well as stress management techniques like meditation and deep breathing. In some cases, medication may be prescribed to control anxiety symptoms. Prevention is the fundamental pillar for avoiding chest discomfort, especially when the cause is a chronic disease. Maintaining a healthy lifestyle is the best defense. This includes a balanced diet rich in fruits and vegetables and low in saturated fats and sodium. This type of diet helps control weight, blood pressure, and cholesterol levels, which are key factors in preventing heart disease. Regular exercise also plays a vital role. Physical activity strengthens the heart, improves circulation, and helps maintain a healthy weight. At least 150 minutes of moderate-intensity aerobic exercise per week is recommended. A well-planned exercise program can significantly reduce the risk of developing angina and other related conditions. Quitting smoking is, without a doubt, one of the most important preventive measures. Tobacco damages blood vessels and increases the risk of blood clots, which can lead to a heart attack. By quitting smoking, you drastically reduce the risk of heart and lung diseases, and your body begins to heal. Stress management is another powerful prevention tool. Chronic stress can have a negative impact on heart health. Techniques like yoga, meditation, spending time in nature, or simply making time for a hobby can help reduce stress levels and, consequently, the risk of anxiety-related chest discomfort. Education about the symptoms and nature of chest discomfort is fundamental for public health. A well-informed public can make safer, faster decisions. Knowing when a symptom is an emergency and when it is not can save lives and reduce the strain on emergency services. It's crucial for people to learn to listen to their bodies. A new, unusual pain or discomfort that comes with additional symptoms like sweating or shortness of breath should be taken seriously. A person's intuition about their own health is often one of the best guides for seeking medical help. The myths and misinformation surrounding chest pain are harmful. The idea that only older or overweight people can have a heart attack is false. Myocardial infarctions can occur in young and seemingly healthy people. It's important to debunk these myths so that no one underestimates the seriousness of their symptoms. In women, heart attack symptoms can be atypical. Instead of classic chest pain, they may experience nausea, jaw or back pain, or unusual fatigue. It is vital that both healthcare professionals and the general public are aware of these gender differences for a quick and accurate diagnosis. The role of caregivers and family members is equally important. It is often they who notice the symptoms of a heart attack or another serious condition in their loved ones. Knowing what to look for and how to react, such as calling emergency services, can be the difference between life and death. In summary, chest discomfort is a multifaceted symptom that requires a careful evaluation and a precise diagnosis. While a heart attack is a possibility, it is not the only one, and a multitude of other causes, from the most benign to the most serious, can be at play. The key is not to ignore the symptom. Finally, the best way to address chest discomfort is through a combination of swift action when necessary, a proactive approach to prevention, and continuous health education. By being informed and prepared, we can handle this symptom with the seriousness it deserves and ensure the best possible outcome for our health. If you liked this video, subscribe to the channel and turn on notifications, share your thoughts on this video, and let us know what you liked. Thank you very much, and we'll see you in the next